The short-term risks of rhinoplasty are bleeding or infection, but these risks are really minimal, and we hardly discuss them with the patients because the percentage of patients having post-operative bleeding or infection is maybe less than 1 to 2%. So in reality, we mainly discuss with the patient the long-term risks, and there the long-term risk is mainly the fact that the result of the patient may not satisfy the patient or the surgeon. And in my own series, because we have done a significant number of studies on outcomes and results after rhinoplasty, we tell the patient that the likelihood of success or the likelihood of a patient being satisfied after rhinoplasty is about 85%. This is not reaching 100%, so patients should realize that rhinoplasty is never an absolute guarantee for success.
The short-term risks are the basically hematomas, infections, and receiving traumas or not taking proper care, especially in the first weeks of their surgery. So patients really need to know that they need to avoid strenuous exercise, they need to avoid being in the sun, they need to avoid swimming pools. Why? Because they can get infected, their bones or any of the changes in their nose can move. So you don't want to have a lot of movement in your face, a lot of things happening in your face right after surgery because you could have serious complications.
Long-term risks are the secondary deformities and the functional impairments if you are not aware about the right technique in the right patient. So long-term means that you have to follow up the patient during all life, because sometimes we do operations that can change after 12 to 18 months, so you have to follow up very frequently. This is what we do normally with picture and videos to take care about the possible deformities, which in literature are different. They run about 5 to 15 to 20%.
Rhinoplasty is one of the most difficult operations in facial plastic surgery, and most of the problems are long-term. And those are basically non-ideal results, facial asymmetries, deformities, and those can be seen. Sometimes you don't see them before 1 year. So you need to let patients know that before 1 year, you can really never know if your rhinoplasty has been a successful operation or not.